Welcome to America's Heroes Group.
Welcome back to America's Heroes Group, this time with a roundtable on our partner, the National Nurses United. Today is Saturday, October 21st, 2023. October is Breast Cancer, Mental Health, National Disability, and Domestic Violence Awareness Month. Our host is Kelley. I'm Sean Claiborne, the co-host. Our executive producer is Glenda Smith. Our digital media producer is Ortega of Scott's Arnold Productions. And I also want to give a thanks to Miss Brown, who donated to our show. Thank you for your support. And we encourage you to also donate to America's Heroes Group to bring you the information that brings you more sound things and sound knowledge about what's going on in the world and also about how we can help veterans. We have a partner with us, Adelena Marshall. She's a Jesse Brown VA mental health nurse. And our panelist, Nancy Karpen. She's an MSN family nurse practitioner and working on a study that is helping us understand how our air quality affects COPD at the Jesse Brown VA. How you guys doing today? You there? Adelena, Nancy? It's like we don't have them on there yet. I see you're on the line.
I'm here.
There you are. Perfect. Is this Nancy
yes,
or Adelena?
Sir. This is Nancy.
How are you doing today?
I am fine. This is Kelley?
This is Sean Claiborne.
Sean Claiborne. Okay, nice to meet you, sir.
My pleasure. So you have a very powerful study going on that's going to look at how air quality and air purifiers or air filters affect people with COPD. Is that correct?
Yes, sir. Would you like me to tell you more about the study?
Yes. Tell us about this study and what's going on with this.
So what's happening is that the VA has been recruiting veterans with chronic obstructive pulmonary disease, also called COPD, to enroll in this home air quality study to find out how this home air quality affects veterans with COPD.
So as far as I understand, this is according to the World Health Organization. In 2019, COPD was the third leading cause of death in the world, with 3.2 million deaths, the people that passed that year. American Lung Association says that in 2020, it was the sixth leading cause of death here in the United States, with 150,000 people that passed from COPD in the U.S.
Yeah.
So tell us the importance of this and what you hope to find from the study.
What we are looking to, what we are investigating are these dimensions of care, or how home air quality affects veterans with COPD. And the endpoints, or what we're looking at, is whether or not these HEPA filters, home air filters that we're placing in veterans' home, either decrease the number of COPD exacerbations or ER visits, whether or not this can help improve a veteran's oxygen levels, or if it has any effect on how far you can walk before getting short of breath.
And then tell us about COPD. What exactly is it, and how it affects the body?
COPD is a disease or a condition that affects the lungs and the tissue, and how oxygen passes through that tissue into the blood. Typically, individuals with COPD have a lower oxygen saturation rate because of the disease process that affects the tissue, that oxygen exchange tissues in the lungs. Veterans or any patient with COPD tends to have lower oxygen levels because the process that has caused COPD to be present for that individual has affected or changed the architecture. They refer to it as the architecture of the tissue of the gas exchange capability of that in the lungs.
Now, with the veterans, so the veterans that are going to be volunteering, do they have to have COPD, or is that part of the prerequisites, or how did you select which veterans are in the program and so on?
Yes, according to the inclusion criteria for veterans participating in the study, they would have a diagnosis of COPD. Some individuals aren't aware of the fact that they have this, because they may have diagnosis like chronic lung dysfunction or other conditions that don't exactly match up with chronic obstructive pulmonary disease. But if a veteran is interested in the study, I refer that individual to Dr. Alfessi. He's the study coordinator at Jesse Brown. He's also one of our ER docs. And he can review that individual's medical chart to find out whether or not this person meets the criteria to participate in the study.
And you guys are working with the Illinois Institute of Technology, IIT, to actually conduct this in order to get the data and also the research that you're doing?
Yes, we are working with IIT. There are and then IIT, they have the engineering capability to bring the equipment to the veterans' homes, install it, show how to work this, and then they're also obtaining data from, so there's a home air quality filter, a HEPA filter, very high quality, that's being installed in the home, and then there's also an air quality monitor and an electricity data monitor that they're getting data from during the course of the study to find out how this is affecting the air quality in the home.
And how many people are you trying to collect for this study?
80.
80, okay. And then there is also a monetary benefit. They actually get paid to be in the study as well. Is that right?
Yes, they will receive $500 total compensation for participating, and it's paid out in 3 payments over the course of the study.
Now, the HEPA filter you guys chose was a type of filter or a type of filtration system that you guys used. Was there a reason why you picked that over, say, like the ozone or the filters versus the ultraviolet filters that are out there?
I wasn't involved in the actual technology selection, so I don't know what their criteria was based on, but it's an Austin HEPA filter. And if you were to go to, I don't have the model number, forgive me, but I looked it up earlier this year. You can purchase those independently at Home Depot or Menards, I believe it is, and they're $700 to $800. Wow. They're very high quality. Wow. Yes, it's a non-medical treatment for COPD, and one of the reasons they're doing this. The Department of Housing and Urban Development is the funding source for this study, and if this proves to be helpful for treating COPD, they would like to offer this as another treatment option. But we have to do the study to find out, of course, if it's effective.
Now, how do people develop COPD typically? Is it just something that smokers get, or is it other things, the factors that might contribute to something like COPD?
I have seen statistics that over 90% of people who develop COPD have been smokers in their life. There are also other occupational exposures, which, like if you're in the military and you're exposed to unhealthy air, and many veterans are, that can also be a contributing factor to the development of COPD.
Because what comes to mind immediately is the burn pits and the situation with how that was with the PACT Act, and how we're starting to take that more serious, and how a lot of veterans have been getting all kinds of different symptoms. What are some of the symptoms specifically about COPD that people could be looking out for if they are worried that they might have COPD?
Shortness of breath, cough, difficulty breathing, phlegm, sputum production, and low oxygen saturation.
Now, are there treatments to this if you have these symptoms? So how do you normally treat this?
There are treatments provided, in the pulmonary clinics at Jesse Brown are primarily responsible for treating veterans with COPD. There are medicines that are available. And I forget, I apologize, I didn't come prepared with the names of those medications. But there are some treatments available for COPD medically, so medicine, and then there are some rehab type where they do exercise, things like that, to help improve lung function.
So it's possible if you could do these exercises. It sounds like it's possible to heal your lungs then.
No, I don't want to give that impression. There can be some improvement experience. They can teach you techniques that you can use to help with your breathing. Typically, COPD is not reversible, sir.
Wow. Adelena, have you had a chance to join us? Are you on the line?
Yes, I'm here, and Nancy is giving out a lot of valuable information. COPD is not curable, and it would probably deteriorate over a period of time. But that exercise, treatment, and medication would allow the patient to manage it so that they're in a more comfortable state. A lack of oxygen with COPD can also affect your mood as well as your memory, and it's very important that our patients become aware of this. You can, one of the signs too, you can be short-winded when you're walking, even around the grocery store or around your house, or doing light housework, yard work, and you become short of breath. That can be an indication that you may be experiencing a form of COPD. So Nancy is our expert in this area for us, and she is giving a lot of information on this study and encouraging our veterans, our listening audience, veterans friends, veterans family. Sometimes you are more aware of the issues that may be affecting the veteran than they themselves. So as a loved one, somebody who's caring for a veteran, somebody who is interacting with a veteran or a family member, if you're seeing these signs and symptoms, encourage them to come in and to at least be tested so that they can be treated and slow down a process that they may be experiencing.
I did a little bit of research, Nancy, before we started this, and one thing that I saw about the reason why I had that question about I was curious about the HEPA filter itself, because I found that there was research and data that shows that that's the right type of filter or filtration system that's best for someone who has like a breathing disorder like asthma or COPD, because ultraviolet can actually be damaging to a person, and ozone, it could actually lead to other breathing problems, from what I understand. And there were studies that found that if you have some of these ozone type filters, I had one in my house. I thought it was, I got it for little or nothing at Home Depot, but actually prolonged exposure to those types of filters, if they're or filtration devices, if they're not used correctly, can actually hurt you for long periods of time. So the HEPA filter seems like it's the best type of filter, and also to encourage our veterans, if you're thinking about getting to do some kind of filtration system on your own, do the research and maybe even get some expert advice. Don't just take my word for it, because I did some research, but get some expert advice about what types of filters are the best for your situation.
Absolutely. And any of the doctors at Jesse Brown, primary care physicians and pulmonary docs as well, would be excellent resources if you're being seen at one of the VAs, to ask them. You can do some of this stuff on your own. I believe there is some research that supports that it improves these outcomes for veterans or for anyone with COPD at this time. But we're actually, doing this on behalf of HUD to determine future treatment options with this equipment. Mm-hmm.
Now, you mentioned that 90% of people who are smokers usually are the people that have COPD. People that have COPD, 90% of them usually are smokers sometime in their life. Can environmental factors also play a part? They may be in a workplace, or maybe getting secondhand smoke in the house.
Secondhand smoke is a large contributing factor to individuals developing COPD as well. Typically, the folks that I see, the individuals who are enrolling, are actual veterans who've had a history of, say, tobacco use or other inhaled substances. The occupational exposures, and I can't list them all, but you mentioned the burn pits. There are other exposures as well that can lead to lung damage and could be a triggering factor for this complication, this disease process.
Wow.
Mm-hmm. We want to bring to everyone's attention that Nancy is also a veteran, and she's an example of many veterans working in the VA system, Jesse Brown, particularly North Chicago and Hines, that are caring for our veterans and that are looking at these studies. The VA does many studies for many other areas, but this one is very important. All of them are important, but we just want to point out that Nancy, she is also a veteran, and we have veterans caring for veterans.
That's really wonderful, because I think that it also helps the recruitment process, I would think, to get people to participate in this study. Have you filled up all 80 spots yet?
We have not. As of last week, the end of last week, we had 63 enrollees. So I'm actively recruiting. We could use another 20. We need a couple extra people if there should be one or two that would decide to exit the study early for one reason or another, which has happened since we've enrolled. But typically I need 17 to hit 80, but having a couple extra probably wouldn't be so bad.
And how do people contact you in order to volunteer?
I have a phone number assigned to me for this study, so this is the number. You ready?
You're ready.
224-817-3602.
Once again, that number, just in case people didn't get it.
224-817-3602.
And how long should the study last?
From the time a veteran or a patient enrolls, they say it's a 12 to 15 month commitment. But here's the deal. There's not a great deal of time that's needed on behalf of the enrollee. There's a half an hour enrollment visit at the VA at Jesse Brown. It takes about half an hour. Some people it might take 35 minutes, some people less. And then within 30 days of that enrollment, those IIT engineers follow up with the veteran to arrange a date and time to bring the equipment to your home, install it, and it's just on in the background. There's an off, low, medium, on high setting on that HEPA filter, and you can change how the sound that the filter makes is very low, and then they say it's 65 decibels on the highest end, which they say is slightly less than a vacuum cleaner. But there's a lot of different vacuum cleaners out there. I haven't heard the high setting. Okay. And then during the course of the study, there's 3 additional home visits where the engineers come in and take data off of those monitors for the study to analyze what's going on. And then there's one final visit back at Jesse Brown. Again, it's an exit, discharge, disenrollment visit, and it takes about a half an hour or less.
And then once again,
we also offer, for our veterans who are smokers, we also offer help and assistance support for those who want to stop smoking. So this is a good time to think about, if you had thought about it, stop smoking, this is a good time to come to the VA. We will help you. We do have lozenges, patches, gum that will help our veterans to cease smoking. So if this is part of their health care plan, we encourage them also to come in so that we can support them with this.
And then once the study is over with, they get to keep the HEPA filter, I'm imagining, right?
That hasn't been decided yet. That has been talked about, but that would be a great bonus feature of the study. The outcome of the study, depending on what this shows, again, they would like to provide these kind of units to veterans as another form of treatment that's not medical.
Mm. And there's other studies out there, we said before, that have shown that the air filters, the right ones, actually do help health in a lot of different cases. Now, how far is that also, I guess, and with the importance of cleaning and dusting your home if you have a breathing problem?
I don't know about. I'm not sure about home maintenance and cleanliness in the home. I would imagine it does, but for actually eliminating or filtering out as many particulates in the air that could trigger COPD exacerbations, breathing issues, low oxygen levels, this would be a way of approaching that for someone with this condition.
So the study, in a nutshell, is they're trying to decrease COPD visits, improve oxygen levels for the patients, but then also trying to detect how far they can walk before they run out of breath, basically.
Yes, there's one component of the enrollment and discharge arm when you enroll. It's called a 6-minute walk test. However, that has not been a factor. We have veterans who have enrolled who are unable to walk or are unsteady, a fall risk. And we've still enrolled them. That should not, if someone with COPD wants to enroll in this study and is unable to walk, don't hesitate to call us. We're still going to enroll you if you have COPD.
And one other thing, Nancy, is COPD something that's you'll find mostly in a lot of older people, or can anybody in any age develop COPD?
Typically, if you're looking at someone with COPD, it's typically an older individual who, if you've been smoking and that's the cause of your COPD, they've been smoking a while. So most of the enrollees are 60 and older. I think there might have been one in their late 50s, one or two, but typically it's a mature adult kind of onset illness.
And Adelena, anything you want to add?
Well, we do know that environmental factors are a good has impacted many of your listening audience and the country with problems with breathing. We do know in certain communities there are efforts to clean up those communities of certain environmental factors that has caused breathing issue, in the community. And so this is just one fabulous program that the VA has vested in to help our veterans to improve their lifestyle and to improve their medical care. And a study is the first step towards helping to find out the reasons for these and then supporting our veterans who may be affected, by this illness.
Adelena Marshall, Nancy Karpen, thank you for your time. Once again, veterans, if you wanted to be in this program, call Nancy Karpen at 224-817-3602. That's 224-817-3602.
Bravo.
Thank
What
you
a
so
great
much.
show. Great.